allergies can put pressure on everything, same way that congestion kind of can.
Sure.
And when it puts pressure, it can either put pressure on those nerves and cause tinnitus. It can cause more stress, which can cause more tinnitus. Either allergies or congestion or both, your tinnitus can kind of flare up a little bit.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Hello, and welcome back to another brand new episode of Ask an Audiologist. I am Kevin Ziener.
I'm Dr. Jordan.
And this feels like a pretty fitting topic today as the weather is changing across the country. The days are getting warmer, the leaves are coming back, and the flowers are blooming. And with that comes, dun dun dun, allergies and their potential effect on tinnitus. So today's article comes to us from Dr. Deanne Rudden of Longmont Hearing and Tinnitus in Longmont, Colorado, a place certainly known for its spring and summer allergies. But before we get into that, Dr. Jordan, I want to know, you live in Louisiana by way of Mississippi.
Correct.
What kind of allergies do you endure, if any?
I don't really have too many allergies, really, I don't think.
No?
But I see a lot of patients and have a lot of family members that do suffer with allergies.
Yeah. I used to be really bad. I think on this podcast I've talked before, like when I was like 10 or 12, our neighbors had this huge, beautiful yellow plant in the backyard that when it would bloom, it looked like it was on fire. It was gorgeous.
Oh, wow.
But the pollen that would come off of it would like wreak havoc on my eyes, and they were constantly watering. I'd rub them, and I even like swelled up so much that I had to put an eye patch on. Not cool. I was not the most hip kid at that time.
Not the stylish kid.
No,
Yeah.
but then as I got older, those Kenalog shots that you can take, managed to like tamp it down to where I'm totally fine now. But if I go back to like the Midwest where pollen can be like a half inch after one day, just entirely body just itches left and right.
Yeah, I mean, it's like our cars. Just walk outside and they're just all covered in a film of green.
Yeah.
Yeah.
I mean, I because Louisiana is so lush and really you're kind of always in season for stuff to bloom.
Yeah.
You guys are actually, your immune systems are probably better than ours.
That's true.
You're just comfortable with it down there. All right. But Dr. Jordan, talk to us about people who aren't comfortable with allergies, and then who are simultaneously suffering with tinnitus. How can allergies kind of wreak havoc on that?
Yeah. You know, you've got allergies, you got congestion. Those things can kind of intertwine a little bit, but they can cause tinnitus on their own. So with allergies, in kind of the same way, I guess, just in different places, allergies can put pressure on everything, same way that congestion kind of can.
Sure.
And when it puts pressure, it can either put pressure on those nerves and cause tinnitus. It can cause more stress, which can cause more tinnitus. So, you know, with either allergies or congestion or both, your tinnitus can kind of flare up a little bit.
And obviously allergies can manifest in a dozen of places, internally and externally, in the human body. But as it relates to this podcast, we don't necessarily care about skin, but we do care about like the Eustachian tube, right?
Yeah.
So there's something called ETD, Eustachian tube dysfunction.
Correct.
Is that something that can be prompted by allergies?
Yeah. So our Eustachian tube is basically what connects our ears to our throat and by way of our nose. So all of those things kind of come together. So whenever we are, having reaction, allergy season, that type of thing, runny nose is going on. You've got postnasal drip, all of those things. And it can, because all of those things are flared up, our Eustachian tube can also be kind of closed off as well.
Sure.
So when that happens, then it can, again, just cause pressure on everything.
Got it.
Same way with congestion. Congestion's just got it basically plugged up with that Eustachian tube, sometimes causing fluid to kind of stay within the Eustachian tube.
Okay.
And there's nowhere for it to go.
Got it.
So that Eustachian tube can kind of open and close.
Yeah.
And when it gets closed off, if there's fluid on this side of where the eardrum is at, then that fluid can't drain back out.
Would that fluid, being sedentary, not going anywhere, be a trigger for tinnitus?
Absolutely.
And again, it feels like the more you people listen to this podcast and the more I learn about audiology, everything triggers everything that's negative in the air. So as you mentioned, sinus congestion, stress and anxiety. But then it's on the flip side that there are potential allergy medications that can trigger it too.
Yes.
And so what are we supposed to do with all of this, Dr. Jordan? Are we just supposed to go lay in the grass and inhale as much allergens as possible to make ourselves immune to it?
Maybe not.
Okay.
Let's skip that part.
Okay. Clearly, I'm not a doctor. Don't ever listen to anything I say on this podcast.
Yeah, I mean, the allergy medicine can also cause tinnitus.
Mm-hmm.
I will say both of these things aren't as common,
Okay.
As you would think.
Like, we don't mean to ever fearmonger
Right.
on this podcast. We are taking a topic that was written that clearly influences individuals, not the masses, not necessarily the majority.
Mm-hmm.
But if you're wondering like, oh my gosh, it's April, May,
Mm-hmm.
and my tinnitus is out of control, a symptom of that could be allergies.
Right. So, I mean, in all reality, tinnitus is a symptom itself.
Mm-hmm.
There's something else that has happened that has caused that tinnitus.
Sure.
So if, like you said, if you feel like it's all of a sudden it's allergy season, it's like, never really thought about it, but that's when my tinnitus flares up.
Got it.
And go see either your audiologist or your ENT and see if you can't nail that down.
And so like if I'm a typical man and I'm like, no, I'm just going to push through it. I'm not going to take medication. I'm not going to see an audiologist or a provider. What risks do I run?
I mean, you're probably going to stress out more.
True.
That's annoying.
So now you're going to tell me I have hair loss. I can't deal with that. I can't deal with that.
Yeah, that's precious.
Yeah.
But I mean, you can try to take some of your over-counter medications. I'm not an MD and I'm not a pharmacist, so definitely check with your regular PCP. But typically you can, take your regular allergy medicine, see if that helps. But if not, if it's something that's ongoing, then go get it checked out.
So here are some like common symptoms of allergic tinnitus. So ear fullness, kind of as you mentioned with the Eustachian tube. Something that is a little more worrisome, but might be attributed to something else, but dizziness can be an issue. Progressive tinnitus due to allergy flare-ups, which I think makes sense, where doesn't have to be like a consistent thing, right? Like you said, you might go out to your car and you brush some of the pollen off and then you unknowingly inhale, half an ounce of it. And you're like, what just happened to my world around me? This is chaotic. You start morphing into some weird trip. Then of course, sinus congestion. But then I think one that people would be worried about is actual physical ear pain. Mm-hmm. That would be something where they would say, oh, I might now actually have a problem. But everything else isn't necessarily ear related. It's just negatively affecting it.
Right. Yeah. Yeah. I mean, that's when like some of the congestion and things that I was talking about where that fluid gets stuck in that middle ear space. Yeah. And then you wind up with an ear infection. The sooner you can treat those other symptoms before we get to an ear infection, the better.
Got it. And so what would your, like as a medical professional, for somebody who might think they're suffering from this or who knows it, but is just looking for a workaround, like what is your treatment options for them?
I would try some over-the-counter medications if you're just the type who just doesn't want to go in and see someone. I start there.
Got it.
Just start with something simple like that. And if that works, great.
Yeah.
But if not, if it's something that's kind of chronic and coming back, go get it treated, whether it be allergy shots, like you said earlier. It could be something more mild than that.
Sure.
They may prescribe you like Flonase or something.
Got it. I mean, one of the things that I like about this podcast is we don't ever let you have notes. We want you to like use your education to speak to the audience. I have the actual articles in front of me. And so one of the things that is in this article is like some of the chemical compounds that should be in those OTC like decongestants, which is like, now these are words I'm going to butcher. Chlorpheniramine, that's something. Terfanidine and meclizine. So look for those.
Yes.
If you have allergies and you also have tinnitus and you want to take an over-the-counter decongestant, chlorpheniramine, which is actually Dr. Jordan's middle name, and terfenadine and meclizine are three of the components in those OTCs that you should look for. That
definitely the meclizine is specifically more so for like the dizzy patients.
Got it.
So if you're having...
See, look, I have to have notes and she knows what this is off the top of her head. It's crazy.
Well, meclizine, it's a pretty good over-the-counter medication for like if you have dizziness. Total segue here. But if you have dizziness, now if it's something that's just a brief, something that's going on, try the meclizine. If that's something that's ongoing, you need to go get your dizziness checked out.
Got it. For
sure. But meclizine is it's kind of like a Dramamine, that kind of thing. It's probably going to make you drowsy, but it can help in a pinch.
And I think one of the things that we should point out is it is rare that allergies like truly induce tinnitus. They usually just make it worse for patients with tinnitus.
Yeah.
So when you listen to this podcast, don't think like you have to stay inside for 90 days because
Right.
the allergies are going to cause it. If you already have tinnitus, allergies typically just make it worse.
Right. Yeah.
So there you have it. Mother Nature just attacking us on all fronts. But to learn more about this subject or anything else having to do with your ears, please visit us at askanaudiologist.com. Dr. Jordan, a heck of a job.
Do what I can.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
In a quiet environment, amplifiers are great.
Got it.
Because it makes everything louder. It's like turning the TV up or the radio up.
Sure.
But when you go into background noise or something like that, you're just taking your problem and making it louder. Okay?
Yeah.
And so for the longest time, that's what hearing aids were. They were linear hearing aids.
Is that the old school ones where like they were draped around your neck and it looked like this huge boom box and then
you
they
got it.
came up to your ears?
Uh-huh.